This is serology and immunology, and we're also going to go over glassware as well in this module. And serology and immunology are the words are used interchangeably, but technically they mean different things. Serology is the study of the serum part of the blood, and immunology is the study of the immune system. But since so many things of the immune system are found in the serum, that's where the term has came from. Okay, so why do we have serology? Um, Viruses and some bacteria will not grow on plates, and we can't test for them, the bacteria or the virus, directly. So we have to test for the antibodies. And the antibodies are found in the serum, therefore that's where the term comes from. So in serology, we measure the antibodies that develop in the bloodstream when you're exposed to something. Okay, let me explain to you what an antigen is. An antigen is anything that is foreign to your body. So it can be biological, like bacteria or viruses, and it can be chemical, like a medication. Even pollen is considered an antigen. So whenever your body sees that there's something there that's not itself, then an immune response is started. And in this immune response, there's a lot of things that go on with different cells and different chemicals being produced. But the main thing that we're going to talk about in this module is antibodies are produced. So when your body sees that there's an antigen, an immune response is elicited and antibodies are produced by the cells. And the antibodies actually go in and attach to the particular antigen to fight it off, to eventually, hopefully, kill it. There are undesirable consequences of immunity. So allergies are a bad thing about our immune system. It's really your body trying to fight off pollen or bee sting or peanut butter, but your immune system goes haywire and it kind of works too much, and it makes you have all of these symptoms. And also, whenever we have a patient who gets a transplanted organ, like they get an organ, maybe they get a heart transplant, and their body starts to reject it, and that's what it's caused by, is our immune system. Our immune system recognizes that it's not itself, and it tries to get rid of it. And also autoimmunity. In autoimmunity, patients develop antibodies to their own cells, which is not normal. So this is what happens in rheumatoid arthritis and lupus. And again, it's not normal. Serum is most often what is used to do serology tests. There are some that require plasma, but most of the time it's serum. There's two types of immunity: natural and acquired. So the first being natural. These types of immunity are available right at birth, so you already have them. And the first thing, if you think about your body, our skin, our nose hairs, the hair, even the hairs on our arm, normal flora, which is bacteria on our body, all of these things help to keep antigens, harmful antigens, out. And also there's humoral secretions, And these are natural antibodies, and the reason that they're referred to as natural is because you already have them. You don't have to be exposed to something to make them. So they're in your mucus, your tears, even in your saliva, your stomach acid. They all have antibodies in them, and they will try to kill anything that comes in. And you know, they're not always successful, but they're there. Okay, WBCs, this is white blood cells. They're involved in natural immunity, and the types that are involved are called phagocytes. And what that means is they eat or engulf bacteria or viruses to try to kill them. And these are monocytes and the granulocytes. And there are three types of granulocytes: neutrophils, eosinophils, and basophils. And these three cells have specialized granules inside of them, and the granules are what actually breaks down the antigen. They engulf the bacteria, and then the bacteria are digested by the cells, enzymes within the cell. Okay, so natural is we already have it. Acquired is when you're exposed to something and you make your own antibodies, which is what happens when you get exposed to a virus or a bacteria. When you get exposed to, for example, strep that causes strep throat, your body's going to see it and it's going to make antibody against the strep. So that antibody is an anti-strep antibody. So it's specific to just strep. Whereas the ones in the natural immunity, these are not specific to any kind of antigen. They fight off anything that they can that comes in. So with acquired, they're specific to each antigen. So there's, I don't know how many, too many to count, different types of antibodies that we have. And also through a vaccine. So this is what happens when you get the flu shot. They actually inject a almost dead flu virus so that your body will make antibodies to it. So then when you get exposed to the flu virus, the antibodies that you'd already produced will help fight it off and keep you from getting sick. Okay, the cells that are involved in acquired immunity are the lymphocytes. So you need to make sure that you know the difference in the cells. Acquired has the lymphocytes, and natural has the monocytes and the granulocytes, which includes these three things. Lymphocytes arise from the lymph nodes and lymph vessels, and the lymphs are the ones that produce the antibodies. And again, they make a specific recipe for each antigen that we're exposed to. Okay, immunology test. This is just a small amount. There's tons of tests that we do where we look for antibodies. The RPR is the most common test that we do in immunology. It's a test for syphilis, and it detects an antibody that our body produces if we're exposed to syphilis. Mono is caused by a virus called EBV, and it causes the disease infectious mononucleosis. So when we do a test, we're looking for the antibody to mono. And Rocky Mountain spotted fever, you know, you get that from a tick, and it's actually a bacteria, and we do the test for that to see if it's positive. Now let me show you one of the older ways to do serology. Okay. So this is a good example. So we put in these little test cards a drop of the patient's serum, and then we put reagent in there. And the reagent will bind with the syphilis antibody if it's there. And if it binds, it will produce this agglutination. So these two are positive, and this one is negative. Okay, so now we're on the glassware. And this is clumped into serology because we used to use a lot of glassware in serology and also chemistry too, even though it's getting more obsolete as the years go by. Okay, so the types of glassware. There's thermal resistant. These are made of borosilicate glass, and you need to know what these are made of. It's resistant to corrosion, thermal, and shock, so it's supposed to be heat resistant. It's best for high precision work and is the most commonly used type of glassware in the lab, so you need to know that. Low actinic is a dark colored glass, like that's what is in the picture, and it is used to contain things that are broken down to the light. So the color of the glass is kind of like a tint to keep the sunlight out so that it can't break down the reagent. Okay, critical glassware. This is glassware where you need high precision and accuracy. And if you remember what those things are, accurate is if we get the true value, and precise is if we get the correct value over and over and over. It's a repetitive true value. Examples of critical glass are volumetric flask and pipettes. They're calibrated, which means the company has ensured us that we're getting what we're supposed to get, and with the calibration that they do, they always have a stated tolerance. So on the pipettes and some of the glassware, you'll see at the top it may say plus or minus 5% or whatever. So that means if in the example we have a 50 milliliter beaker, it has a tolerance of plus or minus 0.05. That means it should accurately measure within 49.95 and 50.05 milliliters. Calibration is the determination of accuracy of an instrument done by measurement of its variation from a known standard. Now, let me tell you what this means in our language. Whenever we do a calibration, we have something that we know has 50 milliliters in it, and then we measure it with whatever we're trying to calibrate to make sure that we get that. On an instrument, what we would do is we have a known sample that's supposed to, let's say our calibrator it's supposed to have 50 milligrams of glucose in it. Then we run that on our instrument and make sure that we get 50, or plus or minus a little bit away from it. Okay, your notes say NBS, and this has been changed to, it's still the same thing, but I have NIS standards, and either one is fine, but the NBS stands for National Bureau of Standards, and NIS stands for National Institute of Standards. But they are an organization that comes up with all these guidelines about calibrating. They say that the glassware has to be calibrated at 20 degrees, which is room temperature, using distilled water. Most precise measurements needs to have critical glassware to be used. So we use critical glassware for making up standards or calibrators making up reagents, making up controls, all of these things that are used in patient testing, we consider those to be um, important enough. We want those to be precise, because if they're precise, then our patients are precise. Okay, non-critical glassware, it refers to the pieces of glass that are less precise and less accurate. And this includes beakers, the Erlenmeyer flasks, test tubes, reagent bottles, graduated cylinders, and serological pipettes. So you need to make sure you know the difference. Um, it has a stated calibration, and the tolerance has a wider range. So whereas the critical, the range may be low like this non-critical may be 1 milliliter. It's going to be a wider range. It's used to hold fluids and measuring solutions that won't be used in testing, like if we're making up a bleach solution, or we're just putting some fluid in a container to use it so we can measure something from it. We can use it to hold it. Okay, pipettes. These are used to measure small amounts of fluid. They can be filled by suction, and I'm sure you know this. Never. This is supposed to be mouth. Never mouth pipette. Um, this is not an issue now, but before HIV, the lab techs used to mouth pipette serum and reagents and blood, and it wasn't a big deal. There wasn't any risk, or they didn't think there was any risk of contracting anything. But anyway, just don't put your mouth on them. Okay, so there's two types of pipettes, a TD, which stands for to deliver, and a TC, to contain. So the ones that are TD, the pipette is allowed to empty. You don't rinse it, and most pipettes are TD. The to contain, it has to be rinsed with diluent to get an accurate measurement. Um, the frosted ring at the top indicates that the pipette must be blown out so that you get the right amount. And these are serologic pipettes. And glass pipettes are usually measured in millimeters. The long glass pipettes are in milliliters. Okay, so the procedure is you use the bulb in your left hand, um, and and this is not exact. If you're left-handed, or you can do it a different way, please do. But you use the bulb to fill the fluid up in the pipette to above how much you want a pipette. You take the bulb off and hold the top of it with your index finger to create a vacuum. You take the pipette out of the fluid, you wipe the tip with a Kim wipe, you go to the container you're going to put it into, and then you release it. The meniscus has to sit at the top of the capacity mark, and the capacity mark is just how much you're trying to pipette. Quickly move to the container to be filled, release the vacuum, just let go of your finger so that the amount will be released into the container. Okay, specific pieces of glassware, volumetric pipettes are never blown out. They're actually pipetted the same way as I talked about here. So with the volumetric, you don't blow out, and the serologic you do. And that's just when you take the bulb and blow all of the leftover fluid in it out into the container so that you get the right amount of volume. It has the serologic ones has graduations. They can be used to measure different volumes. There's different sizes, so they make 1 milliliter pipettes all the way up to 10 milliliter pipettes, and maybe even bigger. Serologic is less accurate than volumetric. you don't use the graduations at the tip for measurement, and you wipe the tip before bringing the fluid to the line. So you want to wipe it lightly just to get rid of any excess on the outside of it. Okay, these are automatic pipetters. These are piston operated pipettes. They have disposable tips that go on the bottom of them. To use it, you twist the pipette tip onto the pipettes, you press the plunger at the top, you put it into the liquid and you slowly release it. You wipe the outside of the tip with a Chem wipe, and you press it to release it into the container that you're using. These have to be calibrated, and in the lab we have to calibrate them. So we have a special pipette, and there's a procedure to do this, but somebody in the lab is designated to do this annually. These can be fixed volume or adjustable. So these in the picture are adjustable. You can change it. It says it'll measure from 5 to 50, and this one from 20 to 200. And then there's some that are fixed and they can only do 10 or they only do 20. And these are measured in microliters. The automatic pipettes are measured in microliters. The serologic and volumetric are in milliliters, so they can do a larger amount. The automatic pipettes are used to measure really small quantities, of course. Graduated cylinders, these are to deliver, so it shouldn't be rinsed. The meniscus should sit at the top of where you're measuring. The bottom of the meniscus should be where you're reading the volume out. And this is used to measure large volumes, of course. Plasticware, almost anything can be purchased in plastic. Analytical reagents and controls are best stored in glass. You need to know that. Distilled water or saline and disinfectants are usually stored in plastic. Advantages for plastic: is cheaper, it won't break, it's stable for some solutions. Disadvantages: it can leave compounds into some solutions over time, so it can disintegrate or it can form agglutinates in the reagent. Some may evaporate, and it can also absorb dyes. And that's it for this module. Let me know if you have any questions.